So finally, you have reached the last and the most challenging part of your pregnancy, the third trimester. The third trimester typically starts from week 28 of pregnancy till 40 weeks or till you deliver. Or you can say the 7th, 8th or 9th month of pregnancy. Now, this is the time when the baby is growing really fast. There are a lot of changes which are happening in your body. The body is actually readying itself for the process of delivery. So, hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So in today's video, we will be talking in detail about the third trimester, the precautions, do's and don'ts. So now let's see what's happening to the baby in the third trimester. So if you remember, we spoke about in the second trimester video, by the end of the second trimester, the baby is almost 1 kg in weight. And when the baby is born, which is typically at about 37 weeks, the baby weighs anything between 2.5 to 3.5 kg. So the baby is gaining weight actually exponentially. So have you ever wondered why is the baby in the head down position? So the baby's head is actually the hardest and the biggest part of the baby's body. And it tends to dilate the cervix better than the other softer parts of the baby's body. Sometimes the baby's head could actually be up towards the mother's chest. Now this is known as the breech position. Sometimes the baby could be in a horizontal position. Now this is known as the transverse lie. Typically, by about 36 weeks or so, the baby actually settles down into a head down position. And then after some time, the baby's head actually drops into the pelvis even more. Now, this is known as lightening. It's so interesting to know that the baby's sense organs are now functioning very well. The baby can see, the baby can actually make out whether it is the daytime or the night time by seeing the red halo in the front. The baby can practically hear all the sounds. Do you know that the baby is most alert when it is listening to its mom's voice? Now the baby can actually smile, the baby can blink, the baby can actually even cry inside. The baby is sucking its own thumb. Baby is developing a good muscle tone. The baby's bones are becoming harder. So this is the time when you all must be eating a calcium-rich food. In third trimester, the baby is actively moving inside. But in the beginning, the movements are very, very erratic. It's only in the third trimester. Now these movements become well coordinated and they actually form a pattern. So actually good fetal movements are indicative of good fetal health inside. So let's understand how do we count the baby movements. So for this, you should be counting the movement on the same time of the day preferably. Do it at a time after you've taken a meal, and that too a meal which was a little sugary meal. Try and lie down on your left hand side and try to concentrate on the movements. Now, the movements could be either just a simple movement, or it could be a kick, or it could be a swish, it could be a roll. So any kind of a movement should be recorded. So you note down the time when the first movement starts, and then see how much of time is required to reach 10 movements. Now it could be 30 minutes, it could be 60 minutes, it could be even 2 hours. Do not worry about that. So do it 3 or 4 times, and in case you find any significant deviations to it, then that is something which must be informed to the doctor. There's another easy way to count the fetal movements is that in 1 hour post meal, you should be getting good 5 to 6 movements, or maybe 10 movements in minimum 2 hours. So remember, in case your movements are a little lesser, please do not panic. You can just inform your doctor. Your doctor might call you for a test which is known as the NST test, or maybe an ultrasound color Doppler to see if the baby is getting good blood supply. One word of caution: even excessive fetal movements or change in the pattern of the fetal movement is also something which must be brought to the notice of the doctor. Which means today, if you feel my baby is not moving the way it used to move earlier, even if the count is normal, even this change in the pattern of baby movements is something which must be definitely reported. So now let's talk about what's happening to the mom. Yes, this is the difficult time of the pregnancy when the baby bump is really big, the abdomen is aching, back is aching, buttocks are aching, legs are aching. So what you can do is, number one, throughout the day, keep yourself active. Make sure that you're wearing comfortable, low-heeled platform shoes. When you're resting also at night, try and rest on your side, preferably the left-hand side, and you can keep a big pillow in between your two legs. Make sure that your posture is always erect. In case the pain is still bothering you, you can do a little bit of hot fermentation. You can even take a tablet, paracetamol. So this is also the time when the uterus starts having little erratic contractions. Now these are known as Braxton Hicks contractions. So it's like the uterus is also trying to prepare itself for the D-Day. So the difference between the Braxton Hicks contractions and the labor contractions are that Braxton Hicks contractions are typically painless and they are very, very erratic. They do not really have a pattern and they do not really increase up to strong labor pains. Remember, there should be no bleeding or blood-stained discharge in pregnancy. So in case you notice a discharge which is a little mucoid and blood-stained, maybe you have passed your mucus plug. In case you notice any fresh bleeding, maybe the placenta has got detached, or maybe it could be low-lying placenta. So in either case, remember, bleeding in pregnancy is never normal and it must be reported to the doctor ASAP. Vaginal discharge in pregnancy is normal provided it is clear, mucoid, without any smell. Now in the third trimester, in case you suddenly notice a very thin watery discharge, this means probably your water could have broke. You know, the baby is enclosed in an amniotic sac, and in case that amniotic sac ruptures, there could be a leakage of a sudden clear watery discharge. So in case something like that happens, put a clean pad and then start to pack your things to reach the hospital. It's also very, very normal to be having a lot of frequent urination in the third trimester, because by third trimester the baby's head actually descends down and now it puts pressure at the urinary bladder. So if you have little urine also in the bladder, you actually have a sensation to go and pee. So remember, it's absolutely normal. But in case this frequent urination is associated with some kind of a pain or fever, probably it is the UTI coming in. Also, pregnant women at this time actually have a very less control on the urination, which means each time they cough or sneeze or maybe even laugh, they may dribble few drops of urine. Now, once again, this is absolutely normal. If you have been doing Kegels exercises, you can actually keep the muscles at the pelvic floor very, very strong, and this can help you to prevent this. Also, before bed, make sure that you do not drink lots of liquids so that you can avoid frequent visits to the bathroom. In third trimester, the varicose veins also become very prominent. So this happens because the big uterus actually blocks the blood flowing back from the lower legs to the heart. So the blood tends to accumulate in the veins down there. So the superficial veins in the lower legs, they become very swollen, they look bluish or purplish. There is a lot of associated swelling also in the legs, but all these things are very, very normal. So make sure that you're walking, make sure that you're wearing comfortable clothes, and when you're sitting, you can actually prop up your legs. It's a good idea to slightly reduce the added salt in your diet also in case you have a lot of swelling, which means stay away from pickles and chutneys. The normal salt which you put in normal day-to-day cooking is perfectly all right to be taken. As we discussed, the breasts, they tend to become a little larger, they become sensitive. You may notice that the areola becomes bigger, darker, there are stretch marks around the breast tissue. In case, if you press the nipples, you would actually see a sticky yellowish kind of a liquid coming out from the nipples. This is known as colostrum. So please do not worry about it. In case the breasts are leaking on their own of colostrum, you just have to wipe them off. You don't have to squeeze, you do not have to press. It's perfectly all right when you are not feeling that chirpy and happy all the time. There is a lot which is going on in your mind. How will my delivery be? Will I have a normal delivery or a cesarean delivery? Will I be able to handle the labor pains? Will I be able to breastfeed my baby? How will I look after the baby? So, first of all, understand you are not alone. Every woman goes through these roller coaster of emotions. It's perfectly all right. It happens because of hormonal changes. You can try and talk with your friends and families. It's a very good idea to enroll in one of the childbirth classes. So now let's talk about what happens during the doctor's visit. So in the third trimester, the visits become more frequent. So typically from 28 weeks to 36 weeks, we call the patients every 2 weekly, and after 36 weeks, it is usually weekly. In case of a first pregnancy, we generally like to do an internal checkup at about 37 or 38 weeks. This is known as pelvic assessment, whereby we basically want to check the bony pelvis. We want to check whether this baby can pass through this pelvis or not. Then let's understand what are the red flag signs. So what are those signs when you know that it's time to rush to the hospital? In case you're having any pain which is coming from the back and coming to the front, it is coming irregularly and it is slowly becoming severe, it is coming more frequently. In case you have a continuous pain in the lower abdomen also, then